It's the most masterful performance in the entire film, just 2 minutes long, where the main character uses only one line of dialogue to portray one of America's most terrifying serial killers. During police interrogation, the protagonist initially refuses quietly. When officers reveal his killing method, he grows anxious and begins mumbling to himself. But when an officer shouts, it awakens the character's hidden personality. First, he turns his face away, appearing frightened and weak. When the officer continues pressing, he turns back, seemingly transformed into someone else entirely. When the officer holds his hand down, the protagonist erupts with irrational rage. This evil, born from within his soul, strikes terror into your core. If you watch carefully, you'll notice the protagonist smirks, mocking the police for their lack of evidence. Amy, the female lead, is an ICU nurse with heart disease and a single mother of 2 children. Without enough savings for her surgery, she must wait 4 months until her employee health benefits kick in. One day, a new experienced nurse named Charlie joins the hospital. Both work night shifts caring for critical patients. Charlie is exceptionally kind and considerate. Even after accidentally discovering Amy's heart condition, he doesn't report her to the hospital. The two become close friends who share everything. One day during their shift change, a colleague informs them that an elderly patient they'd been caring for suddenly died. Amy can't believe it. The death seemed too sudden, yet everyone at the hospital considers it a natural death. While Amy consoles the family, there's a striking shot in the patient's room, Charlie staring at the deceased woman for half a minute with an expression somewhere between hatred and murderous intent. 2 months after the elderly woman's death, the hospital's risk manager brings in lawyers and 2 police detectives because they cannot determine her cause of death. After screening the ICU staff, they discover Charlie had been charged with illegal entry and harassment 8 years ago, though the charges were mysteriously dropped. The detectives begin to suspect Charlie but can't figure out his motive. Soon after, another patient dies from apparent medication overdose, making Amy suspect Charlie might indeed be the killer of both patients. The next day, detectives appear again, rekindling Amy's suspicions. She assumes they're investigating last night's death, but instead, they ask if Charlie was working then. Amy quickly denies any connection to Charlie. The detective asks, "Do you really know Charlie? He's worked at 9 hospitals, but none will cooperate with our investigation." The hospitals are deliberately avoiding scrutiny. This warning prompts Amy to meet with a former colleague who also worked with Charlie at his previous hospital. The colleague reveals rumors about Charlie. They found insulin in deceased patients' saline bags, and several bags in storage had needle marks. This suggests Charlie tampered with the bags before they were even distributed. Amy rushes back to the hospital to check the saline bags, and what she discovers shatters her. The next day, Amy tells the detectives what she found. Charlie had been injecting insulin into saline bags. Since insulin enters the body slowly, it takes hours or even a day to cause death. Police detain Charlie but can only hold him for 48 hours without sufficient evidence. If they can't get a confession, they'll have to release him. This leads to the opening scene described earlier. Due to copyright restrictions, that's all I can share about this film, which is called The Good Nurse.